Today we're going to talk about medical school histology, images of blood. We will see normal blood and the white blood cells identification therein. We will see some abnormal blood, that is a patient with leukemia, and then we'll see some blood cells from a chicken and show you that they actually are nucleated and oval as opposed to being more round that we have in red blood cells of mammals. So we have a little activity where we identify the different types of white blood cells, a little bit about data on the white blood cells and where you expect to find them, and then a little bit of comparison between bone marrow and the cells of the leukemic patient. And then we end up by comparing the red blood cells of chickens to that of mammals. Thank you. Medical school histology, images of blood. Hi, I'm Larry Johnson. I'm a professor at Texas A&M University, and I have a YouTube site, BIBS, that's where you are. And if this information is useful, please consider subscribing to that site. Now, today we'll be talking about blood, and we have some blood specimens that you can observe and manipulate on your computer, just as if you had like a microscope. We have the normal blood. We have blood from abnormal patient. That is, blood is abnormal. And then also we have some chicken blood to show you that some blood is still nucleated, even though mammalian blood, the red blood cells have lost their cells. So to identify blood cells, it should be useful to look at the comparison between the different ones. And here you see the first three groups of cells. They have a lobulated nucleus. That is, the nucleus is in lobes. It's only one nucleus, but it has different lobes. Here you can see them. You can see them here, and you can see them in this case too. And also these have granules. These have kind of lighter, smaller granules. These have big red granules, and these have big blue granules. Oftentimes you can't see the nucleus very well of a basophil because the granules are above the nucleus. Now eosinophils, they lay down flat and the granules are on the side. So red granules or blue granules makes the eosinophil or basophil, or a neutrophil has granules too, but they're much smaller in size. In contrast, you have a lymphocyte, which has a kind of spherical nucleus and a spherical cell with a little bit of cytoplasm. So the nucleus is from here to here and a little bit of cytoplasm. In contrast, you have a monocyte, which has a kind of horseshoe-shaped nucleus and a lot of cytoplasm associated with them. So this is a monocyte. I drew these so to help you identify these. So the first three have lobulated nucleus, different lobes. It's one nucleus, but it's the different profiles of that nucleus. The eosinophil has red granules. The basophil has blue granules, and the neutrophil has a lighter granules. In contrast, the lymphocyte has a dark spherical nucleus with a little bit of cytoplasm, and the monocyte has a horseshoe nucleus and lighter cytoplasm. So those are names of the different ones that are there. If we look at the electron microscopic view of these cells, we see that neutrophil has lots of granules, but they're small compared to the eosinophilic granules and the basophilic granules. Eosinophilic granules have a crystalline structure. That's why you see a dark and light there. It's the crystalline in the granules that are not found in the basophil. So both of these have large granules. That's why you see those either as red or as blue. And you hardly see the ones at the light microscopic level. Lymphocytes are fairly spherical. It's actually not spherical, but it looks spherical at the light microscopic level, and a little bit of cytoplasm. These structures here are mitochondria. They're not granules. And then here we see the monocyte, which has a lot of cytoplasm and a horseshoe-shaped nucleus. So on our specimen, we see a neutrophil, like granules, and a lobulated nucleus. Lobulated nucleus, red granules for eosinophils, Hard to see the nucleus, but the nucleus with the dark blue granules, the eosinophil, the lymphocyte would be a little bit of cytoplasm and a lot of nucleus, and a horseshoe-shaped cytoplasm. So of these, what can you guess? You bet eosinophil. Small granules, neutrophil. Lobated nucleus, big blue granules, basophil. Big cell, kind of horseshoe-shaped nucleus, monocyte. A fairly small cell with mostly nucleoplasm, a little bit of cytoplasm, lymphocyte. So here you can see the comparisons of the different blood cells as drawn here. The red blood cells, the erythrocytes, are the smallest ones of the cells. Lymphocytes could be that small too, or it could be quite large. But these basic granulocytes that are lobated nucleus are about the same size, about 12 to 15 micrometers, a little larger than the red blood cell. Monocyte could be the largest one that we have in there. Lymphocyte is small again, and here you see the percentages of the white blood cells. So the most popular thing you see in there will be the neutrophils. The next popular thing will be the lymphocytes, with some eosinophils, and seldom would you see a basophil and a few monocytes in there as well. There's also platelets, which are quite small. And so here we can see the different structures and what do they do. Of course, oxygen and carbon dioxide is transported by the red blood cells. Neutrophil is phagocytosis of bacteria. If you have an infection, you have a lot of neutrophils. Maybe you've seen the pus associated with a little ant bite or pimple. That's the neutrophils that are coming in to fight that. Eosinophil is involved in parasitic infection. The basophil is involved in inflammation mediators, histamine, and other things that are there. And then the monocyte is involved in making a macrophage, the garbage collecting cells of the body, is what these cells are, transient cells in blood that make a macrophage is what they do. And here we see the ultrastructural characteristics of the red blood cells, are mostly just hemoglobin, in the mammalian cell at least. And here we see the granules, small granules in the neutrophils, or larger granules in the eosinophils and basophils, and then a lot of cytoplasm in a horseshoe shape in the monocyte. The lymphocyte is spherical nucleus, but not always. It could be indented. Here we see some mitochondria located there with a lot of ribosomes. So a lot of nucleus, not much cytoplasm, in a small cell. And then here we have the platelets as well. So here we see the normal blood, a lot of pink associated with, these are the red blood cells, and then we see the white blood cells. There's neutrophil, 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 lymphocytes, neutrophil, neutrophil, neutrophil. I don't know what these two guys are. But if we actually look at our blood sample, we'll be able to see normal blood. On the computer, you can manipulate this, as I mentioned. You can change magnification, click here in magnification, and if we do that, we see a lymphocyte with a little bit of cytoplasm, a lot of nucleus. We see red blood cells. These are red blood cells here. These are platelets, these guys here. And here we see a reticulocyte. Reticulocytes is what's released from the bone marrow, and then it matures in a couple of days to make the red blood cells. So if we click and drag, and we can see some cells here, and we can look at these cells. As we said, most of the cells we're going to see will be neutrophils. So neutrophil here, 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 here. There's a lymphocyte, and there, I'm not sure, that is possibly a basophil. We want to see that many basophils. And so here we can see a lymphocyte, neutrophil, 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 lymphocyte, neutrophil, neutrophil, and then there's another one of these funny shaped cells which is probably a basophil, a neutrophil, 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 and here's a different cell. This is an eosinophil. So platelets, red blood cells, the different cells that we see, but we see a lot of pink cells. I'm trying to see if I can find, sometimes it's good to look at a low magnification to be able to find the cells that you're looking for. I'm looking for a nice monocyte. We see another eosinophil right there. We see a lymphocyte very nicely right there, and neutrophil platelets. I don't see a monocyte. There's a low percentage of monocytes in there, but there should be some monocytes in there. Remember, that has the horseshoe-shaped nucleus and a lot of cytoplasm, a fairly large cell. Here we see neutrophil, lymphocyte, neutrophil. Okay, this guy is kind of big cell here. This is probably a basophil that we see there, and we can see there. I don't know where I can find me. I'm trying to find some a monocyte. I haven't seen any, and I probably will not be able to come up with one in the amount of time that we have here. Here we see a lymphocyte, and lots of neutrophils that we see there. Maybe this is a monocyte here with a horseshoe-shaped nucleus and a lot of cytoplasm, a little larger than this neutrophil. So we see the red blood cells, the platelets, the monocyte, the neutrophil. And so if we look at abnormal blood, well, first of all, you see there's lots of blue. And also you see that here we got the red blood cells here and here and here, and these are the neutrophils that we see, lots of neutrophils. But we also see some that the chromosome is not as condensed as it is in the mature, and we even see some that is very big. What a whopper! So you have large cells and a large nucleus and a light nucleus, light staining nucleus as opposed to a dense staining. It usually indicates immaturity. So the immaturity, it doesn't know if what it's going to be yet, or it started shutting down the material that it's not going to be in the DNA. And also you might know it looks like the cells of bone marrow, big cells that we see in bone marrow. And so if we happen to look at these cells, we will be able to, again, to manipulate these, and we can go and look at these at 100x. And we see the red blood cells, as you see in through there. This is just debris there. But these would be the individual red blood cells. They're stacked together on these. There's 1, 2, 3 stacked together. These would be the neutrophils that we've seen before. They look a little bit odder. But then we see a lot of these intermediate forms. These guys here, like a sickle cell there, those are precursors to the mature neutrophil, and these are even younger forms of the neutrophil. Lots of cytoplasm. That's probably going to be an eosinophil with the eosinophilic granules, but this lighter nucleus, non-spherical nucleus, and a lot of cytoplasm are precursors to the neutrophil. And so this is probably, possibly a leukemic patient that has a neutrophilic myelocyte leukemia. And here we can see different phases from here, there, and then there. That would be a developmental phase that we had. So if we just look at it in low magnification, you can see there's lots of blue. And so the blue is because there's a high density of precursor cells, and also the individual cells are quite large, much larger than what we would see there. Now, if we look at another type of blood, this is chicken blood, and the reason we're looking at this because the red blood cells are shaped differently. They're more oval in shape, and also they have the nucleus. They're nucleated. Now, all red blood cells are nucleated as a precursor, but then the nucleus is popped out. But in this case, they're oval, and the nucleus remains. It's a non-functional nucleus, but it is still in there. And then these cells are either the thrombocytes, which are comparable to platelets, or they are the white blood cells. So if we take a look at that blood, we can see on our computer, and can manipulate this as we wish. Here we can see these are the red blood cells. That's hemoglobin that we see around there, but we see the nucleus in there as well. Also, we can see these cells too. These other cells are either thrombocytes or they're white blood cells. We don't really distinguish those. There's another one there, a spherical one. Looks like it could be a lymphocyte if that was mammalian blood, but I don't know what it's called here in chicken blood. What we want to see here is there are different cells in chicken blood, and the red blood cells are nucleated and they're kind of oval. That's what we want to see. So this is the end of the presentation on medical school histology, images of blood, normal blood, abnormal human blood, and chicken blood for comparison. Thank you.